topic I chose was a pufferfish poisoning outbreak in Bangladesh in 2008. It is commonly known that tetrodotoxin, a neurotoxin, is present in pufferfish. The structure of tetradotoxin is shown in Figure 2. This toxin can also be found in other marine organisms such as octopus, frogs, and worms. In this case, a total of 141 patients were hospitalized, 82 males and 59 females. 12% of these patients died, while 38 patients with their blood and urine sample being tested. 11 out of the 38 samples with less than 1.6 nanogram per milligram of toxin concentration found the presence of toxin in urine but not in blood. 10 of these 38 patients with toxin concentration above 9 nanogram per milligram developed paralysis. 7 of those patients died and 3 recovered without residual side effects. The symptoms of tetrodotoxin intoxication includes paresthesia, tingling sensation, nausea, vomiting, dizziness, headache, and abdominal pain, muscular paralysis, which can also lead to respiratory paralysis, causing death. Majority of the outbreak was experienced less than 30 minutes after ingestion. According to the outbreak of toxicity was measured in mice with intravenous administration, an LD50 of 9 microgram per kilogram was found, which is highly toxic. To understand this outbreak, it is important to define the physical-chemical property of tetradotoxin. The toxin has a molecular weight of 319.2 grams per mole, pK of 8.76, and a log P of negative 6.21. The LD50 is about 10 microgram per kilogram in mice via intramuscular injection. The toxicity test of tetradotoxin has been tested in different organisms and routes of administration, which includes intravenous in mouse with LD50 of 7.3 microgram per kilogram, intraperitoneal in frogs and mouse with LD50 of 14 microgram per kilogram and 8 microgram per kilogram. Oral in rabbits with LD50 of 7,500 microgram per kilogram and subcutaneous in rabbits with LD50 of 650 microgram per kilogram. Even with all the toxic effects, a small dosage of tetrodotoxin can also be safely prescribed to reduce severe pain experienced by cancer patients. Pharmacokinetic properties, which includes absorption, distribution, metabolism, and elimination. ADME has been conducted on rats to evaluate the safety of prescribing tetrodotoxin. At 30 minutes, the drug is distributed into the stomach wall, lungs, kidney, heart, and intestinal wall and plasma. At 4 hours, the concentration in the intestinal wall reaches the Cmax, along with lungs, kidney, heart, spleen, and skin, which has a higher concentration than plasma. After 24 hours, only a small amount were detected in kidney, gastric, lung, skeletal muscle, skin, and plasma, which can also be shown in Figure 3. which represents the distribution of excretion after intramuscular administration. The toxin has extensive metabolism with very low concentration of metabolites, where in plasma, urine, and feces. However, it is too low to be detected by LC-MS, which is the method used in the research. Therefore, more research on the subject will be needed for in future study to safely prescribe tetrodotoxin. The Cmax was reached about 10 minutes after injection, which reaches about 5.56 nanogram per ml. The whole process only takes about 8 hours with a half-life of 2.31 hours. The study shows that the majority of the toxin excreted via urine, while only 0.43% was excreted via bile. This suggests that urinary excretion is the predominant route of elimination. The toxin has a high affinity to voltage-gated sodium channel, which is responsible for changing the membrane potential by opening and closing the sodium channels. With the opening of sodium channel, the influx of sodium depolarizes the membrane, inducing action potential. Tetradotoxin interacts with the domain of voltage-gated sodium channel by blocking the channel and competing with sodium ion by binding sites, which can also be shown in Figure 4. It acts as a competitive inhibitor, causing paralysis of peripheral nervous system. From this, we can conclude that this outbreak is true in that it has similar LD50 to the research. In the outbreak, it described the LD50 to be around 9 microgram per kilogram, and in the study, it described the LD50 to be around 10 microgram per kilogram. However, there are also a lot of points that prove the outbreak to be false, which is that it takes place around 30 minutes of exposure, which is unlikely because according to the study, at 10 minutes is the Cmax, which shows that the effect of toxin has to be present between the time frame of 10 to 30 minutes. Also, according to the study, the log P of the drug is about -6.21, showing that the property of the compound is extremely water-soluble. The polar molecule goes through renal elimination easily and it does not get reabsorbed into the bloodstream. Therefore, the concentration of the toxin in the plasma is relatively low. The outbreak states that the tetradotoxin is extremely toxic. However, with the high rate of excretion, it would not be likely because it will not be highly susceptible to organisms. So this concludes the study of pufferfish poisoning. There are some points where it's false and where there are some points it can be true. But further study is suggested for pufferfish for tetradotoxin to become subscribed to patients.